Panic disorder is a type of anxiety disorder characterized by recurrent, unexpected panic attacks. A panic attack is a sudden episode of intense fear or discomfort that reaches a peak within minutes, often accompanied by physical symptoms such as heart palpitations, shortness of breath, and dizziness. People with panic disorder live with a persistent fear of future attacks, which can interfere significantly with daily life and lead to avoidance behaviors. Symptoms: the hallmark of panic disorder is the panic attack, with the following common symptoms: intense fear or terror, a sudden feeling of doom or extreme fear, often without any clear trigger. Physical symptoms: heart palpitations or accelerated heart rate, shortness of breath or a choking sensation, sweating and shaking, chest pain or discomfort, dizziness or feeling faint, nausea or abdominal distress, hot flashes or chills. Psychological symptoms: fear of losing control, going crazy, or dying, feelings of detachment from reality or oneself, derealization or depersonalization. These symptoms typically peak within minutes but can leave a lasting impact, causing the person to worry about having another attack. Diagnosis: to diagnose panic disorder, a healthcare provider or mental health professional will evaluate symptoms and history. Diagnosis requires recurrent and unexpected panic attacks. At least one attack must be followed by at least a month of persistent concern about having additional attacks or significant behavioral changes like avoiding places or situations. Rule out other medical conditions. Physical exams and tests may rule out conditions that can mimic panic attacks, such as heart or thyroid issues. Mental health assessment. This involves reviewing the person's mental health history, current functioning, and specific symptoms. Causes and risk factors. The exact cause of panic disorder isn't fully understood, but a combination of genetic, biological, and environmental factors likely contributes to its development. Genetics. Having a family history of anxiety disorders can increase the likelihood of developing panic disorder. Brain chemistry. Imbalances in neurotransmitters, such as serotonin, norepinephrine, and GABA, may play a role. Stress and life events. Traumatic events or high-stress situations, e.g., major life transitions, loss, or severe illness, can trigger or worsen symptoms. Personality. People who are more sensitive to stress or prone to negative emotions may be at a higher risk. Treatment for panic disorder is highly effective, especially when it combines psychotherapy and medication. Psychotherapy. Cognitive behavioral therapy (CBT) is the most effective treatment for panic disorder. It helps individuals understand and manage the thoughts and behaviors that trigger panic attacks and teaches coping mechanisms. Exposure therapy. Gradually exposing individuals to sensations or situations that may trigger panic can reduce avoidance behaviors and fear associated with panic attacks. Medications. Selective serotonin reuptake inhibitors (SSRIs), commonly prescribed antidepressants, e.g., sertraline, fluoxetine, are often the first choice for treating panic disorder. Serotonin and norepinephrine reuptake inhibitors (SNRIs). Medications like venlafaxine may also be effective. Benzodiazepines. These anti-anxiety medications, e.g., lorazepam, alprazolam, may be used for short-term relief, as they act quickly, but are generally not recommended for long-term use due to dependence risks. Beta blockers. Occasionally used to manage physical symptoms like rapid heartbeat, but are not a primary treatment for panic disorder. Lifestyle changes and self-help strategies. Regular exercise. Physical activity can help reduce anxiety and improve mood. Mindfulness and relaxation techniques. Practices like meditation, deep breathing, and progressive muscle relaxation can help manage stress and reduce the frequency of attacks. Avoiding stimulants. Caffeine and nicotine can trigger or worsen anxiety symptoms in some individuals. Support groups. Support groups or therapy groups can provide a space to share experiences, reduce isolation, and receive encouragement from others with similar challenges. Complications. Without treatment, panic disorder can lead to various complications. Agoraphobia, fear of being in situations where escape might be difficult, leading to avoidance of public spaces or even leaving home. Social isolation, the fear of attacks can lead to withdrawal from family, friends, and social situations. Increased risk of depression and other disorders. Panic disorder often co-occurs with depression, other anxiety disorders, and substance use disorders. Financial and occupational impact. Avoiding work or other commitments due to panic attacks can affect career progression and financial stability. Prognosis with appropriate treatment. Many people with panic disorder can manage or even eliminate their symptoms. Early diagnosis and commitment to therapy and coping strategies play a key role in recovery. For some, treatment may be a short-term commitment, while others might benefit from long-term support.